Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast. What's up, Everything Medicare Podcast Nation? This is Christian Brindle. Wherever you are and however you might be listening to me today, I hope this episode finds you safe, well, healthy, and in a great spot, both physically and emotionally. This is episode 174, folks. Our offices have been closed, at least physically. We're all working from home. We're still operational at Christian Brindle Insurance Services, but we're just working from home. We're not working from the offices anymore, at least for the time being, as this pandemic continues to kind of carry over. We're keeping an eye on it, kind of seeing how things go, but we are still answering phone calls, returning emails, assisting with customer service related issues, writing policies for people. We're not doing anything different than we used to do, just from a different location. I'm working from home. Our staff is working from home. And so that's why if you're watching on video, I am not in our normal studio. And this might be the norm, at least for a little while, until this whole thing blows over, okay? The cases in my home state in Utah exceeded over 500 people. I saw it growing more and more, despite what our horrible, crappy elected officials here in Utah were saying. And it has nothing to do with their party. I just don't think they've done a great job at realizing the significance of the situation. Essentially, folks, this has been a crisis. Unlike anything that I have ever seen. I think I shared with you on one of our past episodes that I was going through the grocery store at one of our Kroger-owned stores. It's called Smith's out here. And I was going through the register the other day. And I was checking out, and I was talking to the cashier, and she was probably, if I had to guess, in her 70s. And she told me, she said, "Listen, son, I've never seen anything like this in my entire lifetime." And she's been through a lot more experiences than I have. She's seen a lot more crazy things happen in this country than I have. And it was a real eye-opener to me because, for those of you who don't know, I'm 27 years old. I'll be 28 years old in the summer. And essentially, folks, it's one thing for me to say I haven't seen anything, but for someone that's seen probably 3 times as much as I have, over 3 times, as long of a period, almost, not quite, is saying something. It's really saying something. I don't think any of us have ever seen anything quite like this. Stock markets crashed, percentages-wise, in historic numbers. Businesses have closed. Some of them probably may not ever reopen, small businesses. We have a stimulus bill that has come out that we'll be doing an episode about on Wednesday. And it's just a crazy, crazy time in our country. Now, this episode is not necessarily going to be all about the coronavirus pandemic, but it's going to be about something that's transpired and something that's come about as a result of the coronavirus pandemic, folks. I've always been a big believer that anytime there is crisis, there's kind of 2 ways to look at it. You can basically protect yourself. You can kind of take every step you need to protect yourself, or you can rely on the government. And I've never been a person that enjoys, for the most part, relying on the government. That's just not my touche. That's not my style, if you will. Because frankly, folks, I don't believe whoever's in the office is going to really protect me to the point that I need to be protected. No matter what. We've had a significant amount of people pass away. And if you know somebody or a family member of yours has passed away due to this pandemic, I'm so sorry, and I lend my heart out to you and my family's condolences to yours. Um, but this is something that we've never seen before. We've seen sports leagues, a majority of them, I'd say, if not all of them, can't think of any that haven't, close down and suspend their seasons, potentially canceling the entire season. We've seen school districts close down and do everything remotely. Everything that we do in our personal lives has closed down. You know, my daughter has baby gym classes that she goes to this place called the Little Gym, and it's for baby exercise classes. Her mom takes her 2 to 3 times a week, and she really enjoys it, and she can't go. And I hate that for her because she really does enjoy it. And there's other activities she does that she can't do. My wife and I are frequent visitors of our gym. Our gym is closed. We can't go to the gym for the time being. So this is definitely something that impacts things. And now we're coming out with new information all the time, that the virus can live for so many hours on your shoes. And it's just, everybody's wiping down everything. Everybody's afraid of everything. This is definitely a pandemic. Anytime there is something that you could consider a crisis, typically, the Centers for Medicare and Medicaid Services, the government folks, will come out with what's known as a special enrollment period to kind of combat it. And basically what a special enrollment period is it's a time you can change your Medicare Advantage plan outside of open enrollment. At the time of you listening to this, our OEP has ended. Our OEP was from January 1st to March 31st. And we talked about it several times on this show. It was a time when people on Medicare Advantage could change their plan one time. So unless you had some kind of major life-changing event, like you moved out of state or you moved out of your service area or you have Medicare and Medicaid or you have extra help from your state to help pay for prescription costs, or let's say, you came in or out of an assisted living facility, some kind of major life-changing event, or you just recently retired, or you're turning 65 for the first time, you're not going to be able to get onto a new plan or make any changes until our regular annual election period, AEP for short, which starts October 15th, right? Basically goes from April 1st to October 15th, that window. But one thing I learned years ago, especially when I started working in states and helping people in states that had frequent hurricanes. I lived in Florida for a year, as many of you may know, and Florida typically has hurricanes every year. They're coming through every year, sometimes more than one. And a lot of times when there are hurricanes transpiring, the Centers for Medicare and Medicaid Services will put out a special enrollment period for people affected by the hurricane or hurricane areas. This is not new. This is something they've been doing for quite some time. So essentially, folks, this is not something new that we're going to be talking about here, but it is something new that's transpired as a result of everything going on with the coronavirus. The Centers for Medicaid and Medicare Services announced a special enrollment period code COVID-19. Who's eligible for it? What does it mean? Well, I have to take a quick break, and I will disclose that for you in our second segment of this episode. Don't go anywhere. I'll be right back. Welcome back, everybody. Thanks so much for sticking with me through that break. Let's get in to this special enrollment period for COVID-19, kind of what it means, what it has to do with everything, and so on and so forth. So this is basically the announcement that we were sent yesterday. Well, not yesterday. At the time of recording this, it was yesterday. But by the time you're hearing it, it might have been a few days ago. This was basically what was sent out. FEMA has declared a major disaster in the 12 states listed below due to the coronavirus pandemic. CMS, the Centers for Medicare and Medicaid Services, is granting an SEP special enrollment period In these areas specified, and affected individuals will qualify but for the SEP DST. We will continue to update you as we receive more information and as additional states are added. So this is not just going to be these 12 states. It looks like they're going to add states as they become affected. Who qualifies for this special enrollment period? A SEP exists for individuals affected by a weather-related emergency or major disaster who were unable to and did not make an election during another valid election period. So in this case, it might have been OEP. This includes both enrollment and disenrollment elections. Individuals will be considered affected and eligible for this SEP if they reside or resided at the state of the incident period in an area for which FEMA has declared an emergency or a major disaster and has has designated affected counties as eligible to apply for individual or public level assistance and had another valid election period at the time of the incident period and did not make an election during that other valid enrollment period. So what does that mean in English? Well, you need to have a combination of three things going on. If you made a change to your plan during OEP, you're out of the running, my friends. If you made a change to your plan during OEP, you're not going to be able to change, and this is why. You have to reside in one of the areas listed, and I'll give you those areas in a moment here. You have to have had an election period available. OEP could be that election for you. And you also need to have not utilized that election and let it come and go. So if you made a change during OEP, you changed your plan in March and the new plan will take effect April 1st, you're not eligible for this SEP. Okay, because you already changed your plan and utilized an SEP that they feel like they're not going to just give you another one. So basically, this is what we're looking at. These are the areas. At the moment, at the time of recording this, New York, statewide. Washington, statewide. California, statewide. Iowa, statewide. Louisiana, statewide. Florida, statewide. Texas, statewide. New Jersey, statewide. North Carolina, statewide. In Illinois, there's a lot of counties that are included. I'm not going to read them all. In Missouri, Maryland, there are counties listed. Okay. So essentially, folks, this is an opportunity to make a change on your plan if you so chose to in those particular areas. Now, in those areas specifically, my organization is licensed to help you and do business with you at the moment in Florida and Texas. We're still working on California. One of these days we may get it, but Florida and Texas. And if you live in Florida and Texas and you just, would like to have your plan compared, you were thinking about doing it during OEP, but you just didn't get around to it, you have another opportunity. You have another opportunity that you can, get your plan compared if you feel like you were affected by this. Okay. So basically, folks, special enrollment periods don't pop up every day. It's something that I felt like you should be aware of, and it's something that I felt like we should talk about, primarily due to the fact that everything that's crazy that's going on. Folks, some other news on kind of what's going to be going on for us. I do not know, and I do not have a particular timeline on when we will be back in the offices, but we will still be working as always. Nothing will change. If I didn't tell you that we weren't in the offices, you would never know, because you'd still be able to call, get help, talk to people. You would still be able to email me if you're a client of mine and get a response back in the same amount of time I'll have you, and the show would still be going on. The only people that might notice something fishy is the people that watch our show on YouTube and notice that I'm not in the studio. But for all you know, I don't know. Who knows? Maybe I just say I hate the studio. But, I don't hate the studio. I love my studio. I'd much rather be broadcasting from there. But it is what it is, as far as what the kids are saying nowadays, folks. Folks, thank you so much for taking the time and spending it with me here today. I really do sincerely hope that every single person that's listening is healthy, doing well, not too much panic with all this. I mean, I just hope that this blows over very quickly. My optimistic guess, and of course it's just an optimistic guess because I'm far from an expert. I know as much as you do about this whole pandemic, but my optimistic guess is this will probably run through April and then it will start to die down a little bit. I hope it doesn't go any farther than that, but we'll have to kind of wait and see how things develop. Folks, as always, if you want to get in touch with my organization, if you're turning 65, about to get on Medicare, or if you're already on Medicare and you just want to see if you might be able to compare your plan, there may be some situations that you qualify for a special election period, even if you're not in the areas that are listed. You never know. It's always worth looking into. The states that we work with people in at the moment are Utah, Idaho, Colorado, Oregon, Texas, South Carolina, Virginia, Florida, and soon to be California. Again, that's Utah, Idaho, Colorado, Oregon, Texas, Virginia, South Carolina, Florida, and soon to be California. Thanks so much for taking the time, folks. Thank you so much for spending it with me. Stay safe, as always. We'll be back with you with another episode on Wednesday. And if you like this episode and you're listening to it on a platform that allows, please do me a huge, huge favor. Leave us a 5-star review on what you liked. It helps us reach more people just like you on either Apple Podcast or Stitcher Podcast. Until next time, take care, stay safe, and we'll be back.